right? Those two thin plates of bone right here, the nasal bones. Aren't they superficial to the ethmoid? Yeah, if we remove the nasal bones, we would see part of the ethmoid bone and part of the superior nasal conchae. Nasal bones, I like to move on. Inferior conchae, also known as inferior nasal conchae, okay? They are their own unique bones. You see this? Inferior nasal conchae, they are not a part of the ethmoid. They develop independent of the ethmoid, but they have the same function as the nasal conchae of the ethmoid bone, to warm and moisten the ear. Inferior nasal conchae. Can you see the middle nasal conchae? The middle nasal conchae above? Can you see the middle nasal conchae? But you can't see the superior nasal conchae because they are hidden. Now we come to the mandible. The mandible, our lower jaw is here. Okay. Got it. The body is what you see here. The body of the mandible is here. This is the body. This is the body of the mandible. Okay, I don't have certain things on here. Okay, but okay, coronoid process is okay. We have the coronoid process, we have the mandibular arch, okay. See this little groove right here? This is called the notch. This is called the mandibular notch here. And that's a really interesting landmark because it's going to separate two bone markings, okay? It's going to separate the coronoid process here that my fingers are touching, coronoid process, excellent point of attachment for muscles. It's going to separate the coronoid process from the mandibular condyles. So the mandibular condyles are these round, smooth structures here, and they fit into the mandibular fossa of the temporal bone. So condyles usually enable bones to attach to other bones. But if you look closely, you'll see the coronoid process is not attached to another bone. You see? It will serve as a point of attachment for muscles. Is everyone okay? Mental foramen. The mental foramen, do you see the holes here? I have one, a pointer and one. This is a mental foramen. Mental foramen, blood vessels, nerves. The mandibular foramen is located inside, so we have to turn the mandible so that we can see inwardly. So we can see inwardly, and you can see here. Do you see that mandibular foramen? Mandibular foramen. Mandibular foramen. Mandibular foramen. The auditory ossicles are three small bones that are located in the middle ear, which we cannot see. Okay, this is the part of the external ear, and that will take us to the middle ear. Okay, we don't have the three ossicles here. Okay, so I'm not going to ask you to identify them, but when you move on and you focus on the ear, you will have to know the malleus, incus, and stapes. So you'll cover this if you're concerned. Okay. Now the hyoid bone, we have one of them. Okay, and they are not associated with the skull, but they are part of the axial skeleton. And usually on the models, they appear to be attached to one of the cervical vertebrae, when in actuality they're not. They don't attach. They don't attach to any bone. So they're really not attached to any bone whatsoever. So whenever you start looking at the disarticulated skeleton, you'll see probably the hyoid right here. You'll see the hyoid bone. Right here. This is the hyoid bone. And you'll read about in the literature about this being an excellent landmark whenever coroners are trying to identify the cause of death, like with strangulation, because this tends to break. Okay, now with the hyoid bone, we have the body, which is what you see here, similar to the body of the mandible here. We also have the greater and lesser horns. Another name for horn is cornu, cornu, C-O-R-N-U. You can call them horns, that's what it means. Cornu means horn. So you see this area right here and this area here? These are called greater horns. So what I'm touching with the fingertips are the greater horns here, the ends of the hyoid bone. Excellent points of attachment, enabling this bone to attach indirectly to muscles by way of tendons, okay? And then you see these protrusions here that sort of like look like canine teeth. Those are the lesser horns, attachment points as well. So we have greater horns here, and we have the lesser horns here. And I urge you, if you have time, scan over what these particular structures actually attach to. You're not going to be tested on that. I'd like to move on. The paranasal sinuses, unfortunately, the bones, the plastic models do not show the sinuses. The sinuses are enclosed spaces, okay, that are lined with mucous membrane. Sometimes they become infected. But there are 4 bones that contain paranasal sinuses. When you think of para, you think of around the nasal cavity. And I'm going to name those bones right now. They include the frontal bone, the maxillary bone, the sphenoid bone, and the ethmoid bone. So the frontal bone, the maxillary bone, the sphenoid, and the ethmoid bones, they all contain these sinuses. And I'm not really going to ask you about the sinuses in lab, but I'll ask you about them in lecture. So for your lab and lecture, you're going to see a lot of redundancy. So whatever I don't ask you about in lab, I'll probably ask you about in lecture. Okay. I'd like to move on, please. Now we come to the vertebral column. Okay. It asks you to observe a vertebral column and to identify vertebrae. Okay. So basically, you will see a vertebral column. It may be disarticulated. We just don't have the disarticulated structures at this point. But if you look at the skeleton, Miss Kang, may I ask you a favor, please? Yeah. Can you wheel the skeleton over? Thank you. Yeah, the first one. I think that's more stable. Thank you.
The second one I brought last time.
Isn't that the one that fell last week?
Yeah.
Or something? I know. Okay, so with the vertebral column, you should know that there are typically a total of 26 vertebrae. A total of 26 vertebrae, typically. Of the 26, the first 7 are the cervical vertebrae. We call them C1 through C7, cervical vertebrae. Cervical vertebrae. Now, the first cervical vertebra is always called the atlas. Atlas, A-T-L-A-S. You have to know this for your exam. The first 2 are crucial. The first cervical vertebra is called the atlas. The second is called the axis, A-X-I-S. So T comes before X, okay?